talk to your young female patients about chlamydia testing.
Do you think you need to get tested for chlamydia today? We could test you for chlamydia today. Do you want to get tested? We recommend a test for chlamydia to everyone under 25. Let's test you today while you're here.
The way you talk to patients makes a real difference in the choices they make. Here we're going to look at examples of language you can use that normalizes testing and makes it a routine part of care. And for young women under 25, chlamydia testing should be routine. CDC, ACOG, the U.S. Preventive Services Task Force, the American Academy of Family Physicians, and the American Academy of Pediatrics all recommend annual chlamydia and gonorrhea screening for sexually active young women up to the age of 25. Are we testing all young women as recommended? Far from it. Current data show we're only testing about half of all young women. We're missing opportunities to test. So, how can we improve screening rates? One strategy is opt-out or universal testing. The goal is to test all young women ages 15 to 24 as part of routine care, as recommended by the guidelines. Let's look at this first scenario. Monica is a 21-year-old woman who's come in for a Depo-Provera shot. She doesn't have a record of being screened in the last 12 months. This is an opportunity that shouldn't be missed. Let's see some examples of normalizing language you can use.
So, it looks like you're here today for a Depo shot. We recommend a test for chlamydia to everyone under 25. I'd like to do that today.
Oh, I don't know. Do I need to get tested?
We test everyone your age for chlamydia. It's very common in people your age and often doesn't have symptoms, so you may not even know you have it. That's why I recommend testing. Do you have questions or concerns?
Well, how does the testing go? Is it a blood test? I'm already getting one shot today.
We can do a simple urine test. We can use the sample that you already gave us if that's okay.
Okay, sure.
It can be as simple as that. By emphasizing the practice rather than the patient, you can reassure your patients that testing is routine. Just like the doctor says,
we test everyone your age for chlamydia.
This type of language lets the patient know that testing is routine and normal. Let's look at another example. In this case, Nicole, an 18-year-old woman, is in for a confirmation pregnancy test.
I don't see a recent chlamydia test on your chart. Have you been tested in the last year?
No, but is that necessary?
We actually ask all of our patients your age if they've been tested for chlamydia recently. That test should be done every year. I'd like to do that today. Do you have questions or concerns?
Yeah, why chlamydia, and why do you test everyone my age?
Chlamydia is very common in young women, and often you'll have no symptoms. But if it's left untreated, it can cause other health problems. By testing, we can make sure we keep you healthy.
Oh, okay, sure. That sounds fine.
This is why it's important to follow the screening guidelines. When chlamydia goes undetected and untreated, it can lead to other complications, including pelvic inflammatory disease, chronic pelvic pain, ectopic pregnancy, and infertility. The guidelines extend to female adolescents, starting at age 15. This means you may also be talking to parents about screening. By that age, however, a provider may be taking some time to talk to the adolescent patient alone during the visit. Let's look at how to discuss this with a parent of a teen patient named Chloe. First, you can explain the normal course for the visit.
So how our visits usually work is we'll spend some time talking together about Chloe's health history and any concerns that you or she might have, and then I will also spend some time alone with Chloe. At the end of the visit, we will all meet together again to clarify questions or follow-up plans.
Is that really necessary? I'm always with her.
Some parents may be resistant to this. Try introducing the concept of fostering self-responsibility and confidentiality. You can emphasize that this applies to all adolescents. It's not specific to their child.
At this age, it is developmentally appropriate for Chloe to start taking responsibility for her own health. And it's also our office policy that all patients do spend some time with the doctor alone.
You can also emphasize that you are a trusted source of information for their child.
I know that some kids don't feel comfortable sharing everything with their parents. I hope you feel good knowing that she has a responsible adult, her doctor, who she can talk to about any health questions.
Okay.
When talking about chlamydia screening with a parent, you can use the same type of normalizing language. Discuss testing as a routine part of preventative care.
We recommend routine screening, much the same way we recommend regular vision and hearing testing.
Again, normalizing language focuses on policy and practice, not the individual patient. There are many ways you can talk about screening that can make that focus clear.
Testing for chlamydia is simple. Let's test you today while you're here. To keep you healthy, I recommend testing for chlamydia. It's a common infection that usually has no symptoms. We encourage all of our patients to get tested.
As a provider, your recommendation carries real weight. Research shows patients rely on their providers and the recommendations that they make. You can normalize sexual health and preventative care when you talk to your patients. Look for more resources you can use at the website of the National Chlamydia Coalition at chlamydiacoalition.org.